Good evening. Welcome to VATV show this evening. Today is May 6th, 2015. VATV is the voice of Vietnamese American from the greater Boston area, and it is sponsored by VATV, which is Vietnamese Initiative for Development. You can follow our program live on every Wednesday from 7 p.m. to 8 p.m. on the BNN TV network via cable Comcast Channel 9 and RCN Channel 15, and also online at www.bnntv.org. This evening's program will be repeated on the following schedule: Sunday at 5 p.m., Monday at 1 p.m., and Tuesday at 11 a.m. So for today's program, we have the honor and pleasure to have Dr. Nghiem, a psychologist from Cambridge Health Alliance Asian Mental Health Program, and she is the director of the Asian Mental Health Program there. So Cambridge Health Alliance is affiliated with Harvard Medical School. So you can call us if you have any question, or if you want to make any comments, or you want to talk to Dr. Nghiem. The call-in number would be 617-708-3290. So welcome, Dr. Nghiem. We're so happy that you're here. This topic is just so important. So just tell us a little bit about you, if you don't mind.
Sure. Well, first, I just want to thank you so much for having me. I was really delighted when I heard that VATV and the Vietnamese community was even interested in talking about the topic. About the Vietnam War and those who may be impacted from trauma experience even today. So it's a very important issue, and so thank you for just bringing the visibility.
Yeah.
What I do at Cambridge Health Alliance, this is my primary affiliation, and as a director of the Asian Mental Health Program, I wear a couple hats. One is more traditional clinical services, so what we may hear about psychotherapy and working one-on-one with someone. And I work with individuals, I work with families, and sometimes I work with couples as well. And to give an idea of the range, my youngest patient has been around 3 years old, and my oldest patient has been almost 80. So there is a range across the lifespan where psychotherapy and getting behavioral health services can be helpful for some.
So then the term post-traumatic stress disorder, PTSD, is known. It's so known, but yet people are not sure that they understand fully to the range of the mental health issues that these patients have to go through. Could you talk a little bit about what it is really?
Sure. Well, maybe I can use an example, and especially since we were just recently celebrating the 40th anniversary of the Vietnam War ending, and I'll use a few examples just if the war, if you have been impacted by the war or have lived experience. But actually, post-traumatic stress disorder, you may hear people call it PTSD, and that's just short. Actually can occur when anything in your life you experience as very challenging, difficult, scary or painful. So it could be from a car accident to a natural disaster.
I see.
As we think about so many people in Nepal right now struggling, a war, as we've been talking about, but also people can develop challenges that would fall under post-traumatic stress behaviors or symptoms from relationships. Sometimes in a family or also in a community, one can respond in such a challenging way because the actual event was very painful and can be very scary. So it can be a range of things.
I see. Because many of us, especially me, when I heard of the term PTSD, I thought more about the war, and especially the Vietnam War for Vietnam vets, that were involved in Vietnam. So how does that, affect them? Is it long-term, short-term, and what are the behavior like?
Okay,
Yeah.
it's a good question. So using more recent events, as we've been all reflecting on the 40th anniversary.
Yes.
So someone who has experienced the war as something that was very difficult or painful or scary, some type of a loss. So it could be, let me be clear that it's not only someone who is in the military.
I see.
So it could be a little girl, a little boy, a pilot, a Vietnamese, an American, a Black American, you know, a woman, a man. And so, and what happens is everybody's experience is different.
Right.
So some of the more common behaviors we see, and I'm going to, there are 4 categories.
Okay.
And then there's some other more subtle behaviors we may see. So what we may be able to see or hear with our eyes or be able to see in others, one is somehow re-experiencing it. And what I mean is, let's say you had a situation, an event, as you were on your journey from Vietnam to the US, or several events together. Re-experiencing could be in any way.
Right.
That could be nightmares. That could be during the day you sort of daydream and think about the experience. And another way it can be experienced is sometimes people report that when they remember the experience, it's not like from far away, that they actually remember it as if it's happening right now. So that is what they sometimes use the word flashback for.
I see.
So one, any way someone re-experiences it, either thinking about it often and going through all the different steps, nightmares, and sometimes daydreaming, and then sometimes when it can be extreme at times where you not only remember it, but it feels as if it's happening right now. And you can imagine that can be very scary. So that's number one, re-experiencing. Number two, a second more explicit, or I should say something that we may be able to see more often, is avoiding. So avoiding is very general, but some ideas, some examples, I should say, would be someone who doesn't want to talk about their hometown or doesn't talk about what happened before. It's not because they forgot; they don't want to talk about it.
see.
They sometimes someone may avoid places where they may see a lot of Vietnamese folks who remind them of that time in their life.
I see.
So anything to avoid it coming up, and it may not be that they ever experience something scary, but they just rather not. Let me just avoid the situation. It's almost like if you unfortunately got in a bicycle accident on this one street, and you were able to get treatment, at least basic treatment, but you stayed away from that street. And many streets nearby, you didn't even get close. So that's one way. A third way is that people have what is called being hypervigilant. So it's an increased arousal. And that's sort of a long way to say maybe a noise or hearing something outside may frighten you.
I see.
Much quicker. A door closing, which to maybe every day, if you didn't have a traumatic experience, it might be irritating or annoying, but you might not get as startled and respond as quickly. And so that can be very scary because, I mean, especially for those of us, we live in Boston, many of us take the subway.
Yes.
And it would be very difficult to go throughout the day, either by subway or on foot, not hearing different types of noises in the community. So that can be difficult. And you can see someone responding quickly.
Yeah.
The fourth category, and some more subtle behaviors or signs, is something we can't really see on the outside. And this is something I really want to share with folks and let them know, is just a negative feeling about yourself, how you think about yourself, feeling that there's shame, perhaps, that you're not good enough or there's something wrong with you, or other feelings that are negative or uncomfortable. But sometimes we don't see that, and people can hide that. For example, when we feel shame, it's not that we want to share with everyone. Right. So if we feel shame, we tend to sort of step back, we may hide, or we don't want to be seen. So that can be a tricky one, because some folks who may be experiencing still some post-traumatic stress symptoms or signs, we may not get to see it because we don't see them that often. So that can be very debilitating, because if we feel very badly about ourselves, it may impact our relationship with our family when we're at work or at school. Even though we may have opportunities, we still may not feel that we deserve to be there or that it's safe to be there. So that's something that is more invisible, that in my experience working with folks in the community, sometimes it takes a while to really hear sort of that story they tell themselves inside, because it's also extremely vulnerable to share that. Right. So some of the other signs we can't hide. If I heard a loud noise, you might see me react. So I can't hide that. Or
I see.
If you see me avoiding going to certain places or certain topics, family members or friends might see that, but you may not see, when I'm alone.
I see.
Or sleeping, or my internal thoughts, that some of the judgments may be really quite harsh and unfair.
So then, is there an association with depression? Is it similar symptom pretty much, or?
Depression is something that often we see that a person who has experienced trauma, who hasn't had the opportunity to have support, or has not felt safe enough to talk to their providers, their doctors, or their family. And so, yes, we do see depression often, because, I'm generalizing somewhat. So those are some of the symptoms and maybe signs we see for those who are impacted by trauma. But when we have depression, it may be from many different things, but one of the main primary reasons, or I should say primary events that contribute to depression, is a loss. So you can imagine anybody, for example, who is from Vietnam and had to be relocated not by choice, that is just one loss that a whole country lost.
Right.
So that in itself, we just start with that, is something that someone could be vulnerable to feel the sadness, to feel the loneliness or depression. And as we have recently learned more about this with the recent documentary Last Days in Vietnam, and some of the great work people have been doing to share stories, that only is the beginning of the loss. There are many different losses, from your identity to your home to perhaps family separating. So I know that those are more basic. So yes, absolutely, depression would be something that may come up for folks.
So how do they get help? And could you, depending on the condition and the severity of the mental stage, maybe the different kind of treatment, what are some of the basic things that, as you experience this, you want to seek for help? I mean,
that's very important. And Mary, let me step back just a few moments, because there's some other signs and symptoms of trauma.
Okay.
And still being impacted by trauma that I'd like to talk about, that sometimes we don't see. There's another piece of trauma. For some people, again, it may not be so clear on the outside that they are still experiencing trauma, but if a person or a family member, someone we know, if we notice there are certain parts of their memory that is very hard for them to recall. It's almost like it's separated somehow, fragmented. Then that shows us that there's something there that has been difficult, and perhaps they haven't had the safety or enough support to cope with that.
I see.
And one way that we survive in difficult situations is to almost involuntarily, we don't even do it purposely, to sort of cut off a part of ourselves. Or sometimes it feels somewhat fragmented. And so that's a sign. So if we see folks in the community, there's just certain parts of their history they don't have access to as easily, that's a sign. But how it also plays into today is that because when a part of us cuts off our past, we don't get to choose what we cut off from today.
Interesting.
So that it may impact sort of when we're learning, it may impact trying to organize thoughts, relationships, and all sorts of events that happen today. And so that same person may struggle with some problems that appear as if there is damage neurologically, and there may be some memory issues, but it may not be because it's something biological or something happened in the brain that's more physical, but it may be more spiritual or emotional. So that's another thing, as you can imagine, we don't really see.
That's right.
Unless people talk about it. And also, the person who experiences it, let's say if I'm someone who has those experiences where I dissociate part of my experience or part of my day-to-day, how will I know until all of a sudden I get some more information about it?
Right.
If one day my awareness opens up, or one day someone who I'm working with, and it doesn't have to be a medical doctor, it could be a very loving and supportive friend or community member, one day they communicate something back to me or mirror back to me, and we realize, oh, there's a gap here, and something here needs to be looked at. So I really want to point that out, because that's something that has been overlooked in terms of someone experiencing a lot of challenges from war or health issues, or mental health issues.
Right. And it's hard to say, like you said, that maybe the person who has it might not know that it's a problem.
Yes, especially if it's more invisible, or especially if you're not aware of that piece. You know when you get frustrated from noise, or you notice your heart beating because someone brings up a topic that you feel uncomfortable. Those things, you have an idea that doesn't feel good. But if we ourselves in that moment are not aware of it, that can be difficult. And let me be clear that when a person responds in that way, where part of their self, a part of their identity is disconnected, some people use the word fragmented or dissociated.
I see.
It's not because they're weak. It's actually in that moment they used whatever resources they had. And so actually they were very brave and to cope that way. But what we would like to tell people is that was in 1975 or 1980 or 85. And you did what was needed then. But that's where the work is, to really honor and validate some of the tough choices people had to make to survive, so that they are willing to take the chance to open up, to try something new.
So then, in the Vietnamese community, then, what, to your guesstimation, that is, what's the percentage of Vietnamese American that are suffering from this symptoms?
My experience is someone, especially, for example, during the wave that was very difficult in 1975, that first wave, and also the wave, and Mary, please correct me if my timing is a little bit off, when there were more families leaving when the military was not there to help, where there was a lot of pirate activity, and it was traumatic and different.
Yeah.
The first was there's not enough space. Do we stay together with our family? Do we get out? But the second was doing whatever you can to leave.
That's right.
And so with that group, and we know there are many different waves after that. Right. I can say with that group that everybody who has impacted, who has gone through that, has had some type of behavior response or impact that would be, someone could say, observe it as a post-traumatic stress response.
I see.
And, that's the part in terms of in medicine or in healthcare. And I say that because to have a response like that is human and natural. So that is, I would be worried if folks did not have a strong response. Where there is more trouble or more long-term challenge is after that, if there's not an opportunity to safely talk about what may be going inside of you and what you remember. So it's more that over time, there are opportunities, and there are many reasons for that. You have to come here and get ready to work. You have to support your family. Thinking about yourself seems like a luxury. So there are a lot of different competing demands. And also when people come here, they may not be, may not feel safe talking to anyone about it. So again, it's part of the context and the situation where we are in history and what demands are that sometimes can be barriers for folks who have experienced a traumatic event to get the help in a timely fashion.
And what if they don't? Would they be able to live with the rest of their life like the way they are? Because a lot of times people can be in denial to think that I have problem. For example, if people come with the flashback, even if they haven't gone through the hardship of being tortured or and beaten and so forth, or but they're still afraid. They still have nightmare, thinking, what if that I'm being stranded or I'm being left behind. The fear of getting stuck back, in Vietnam under the communists. It's a scary thought. And although that hasn't happened, but they continue to have that fear in them for years. And then, I don't know, maybe over time, less of these nightmares, will come. But is that a sign anyway? Although they haven't gone through that situation, but the fear is in them.
Let me answer this question two ways. There are people, and perhaps in the community, that do live with some very challenging post-traumatic stress behaviors and conditions, yet they still go to work and they still have a family. And so, and it's very difficult because, there's a lot of energy, one, in that you have to cope with some of these challenges, but two, you have to be okay to get to work. And some people cannot do both and do both well. And so usually if you ask, how can people get help? When I see people come into my office, and not just Vietnamese, anybody from any background, even, someone who might seem like they have a lot more privilege. Excuse me, a Caucasian gentleman, perhaps lived in this country for many generations. Not always, we can't assume that person's ready for help in the beginning. So just as, human nature, we often wait pretty late to do that unless things get very difficult. There are people who will continue to have symptoms their whole life. That's true. sometimes, do they reduce little by little over time without any treatment? Yes, that's true. But more times than not, without some type of support, those behaviors will continue to impact your life. And one way to think about it is that I ask people, therapy may not be for you or coming to get help, but I always tell people when I meet them the first time for an intake, or if they're considering therapy or they're saying therapy won't help, I just ask them whatever's going on with them, be it sleep problems, be it nightmares, be it eating, be it relationship problems. I ask them two things. One, how does it impact your functioning? How does it impact your relationships? How does it impact your ability to work? How does it impact your ability to be in school? So it's more about functioning. Right?
I see.
And number two, the question for the person that is considering therapy is that, are they ready to work on some of these issues? Sometimes someone is aware of what they may be struggling with, but they're not ready. And so they may say, okay, I just need to know that you're at Dorchester House or Neponset Health Center or up at South Cove. I'd like to hear a little bit more, and maybe I'll come back. So two things are really important. So one is I would speak to someone new that would like to work with me. I would ask them, how does it impact their functioning, and what do they wish for? But also number two, if they're going to come in and they're not ready, even though I want them to be ready, even if the family wants them to be ready, it's not the time.
I see. So what's the percentage of the Vietnamese patients that you see at Cambridge Health Alliance? What's the makeup of your patient base?
At the Cambridge Health Alliance, I probably only see about 20% of Vietnamese. I also see, part of my role there, I serve patients who are Asian descent but from other countries, as well as, even though we are technically the Asian mental health program, our group is pretty diverse, and so we see folks who have lived here all their life, but we want people who are in the community to know that if you would prefer to be seen by someone who is Asian descent or speaks your language, then they would always be top on the list.
I see. So for the 3-year-old that you mentioned, because it's a wide range of ages, how do you treat, especially the child is so young, how can you assess the behavior to be, unusual?
Okay, it is a good question. And one thing I'll go back to is the functioning. So if we think about a child who's 3 or 4, what are some common milestones for a child who's 3 or 4 in terms of, let's say, sleep or eating or potty training or even communicating? Are they able to communicate? Do they, when they get frustrated, do they hurt themselves? And I don't mean, kids are kids, and sometimes they do that. They're experimenting, or they push a brother and sister. But if we see something that is difficult for them to tolerate, any type of weight or tolerate it, we can see that. And so that's part of the assessment. And certainly, of course, when children come in, it's usually brought in by teacher, by parents, or a medical doctor that's concerned. And a lot of it is observing while they play. And the therapy for children at that age is to play, is to use their language, is to get on the floor with them, and in a very natural way, work things out through toys and games through play.
I see. What's the average length of time for treatment, depending on the situation, but what's the average length of time, for you to treat one person from having the symptom to becoming better under certain kind of medication?
Some people I'll just speak briefly about the medicine since I'm not a prescriber. For some, yes, medicine is helpful because especially if the anxiety is so intense that it's hard to leave your home, or it's hard to be able to be on, outside on leave your home and be at work or with others, or even being able to sit on your own. And so those are more rare cases. And so the medicine really helps with more short term. If someone's having nightmares or difficulty with sleep and the anxiety where it's very difficult that you really can't do anything else. But often with some support from medicine, it's not for all, but for some it really helps take the edge off, for lack of a better way to say it, so they can do the work. And treatment, it ranges, and I think therapists from different backgrounds would give you a different answer.
I see.
There are some people that I have worked with for over 10 years.
Wow.
There are some people that I work with only a few sessions. And partly it may be their readiness, and partly that's all they needed, because it's an ongoing journey. So I'll give you an idea. For the start, in terms of someone who's experiencing some of these symptoms or signs, and first and foremost, as a therapist, as a provider, we really work with the client or patient, depending on your setting, to just have safety and self-care. Is to work with them in terms of, as much as possible, to increase safety, being with themselves and in their home, and self-care. And it might seem simple, but that's, one of the best medicine. When I say self-care, I'm talking about, of course, adequate sleep. As much as you can, even if you don't feel like it, to please increase your vegetable intake and fruits. And please be mindful to balance that out. As much as you can. Let's say you're too anxious to go outside often or for too long, then I would say fair game, do it inside. You can do some stretches or yoga or anything. Painting, anything to move. And so I'm talking about some of those basics to get that safety and self-care, to get a routine. And that routine may be going to school, going to work, even volunteer. It doesn't have to be actually going somewhere for 40 hours, even if your goal is to say, this is going to be my commitment, my personal goal, and I'm going to try to work on this for this amount of hours. And it can start with 1 hour. So that's to start. And so it's not fair to the person who's coming in to start to delve into some really difficult issues unless you feel like you're planted. You feel more rooted and feel more grounded. Now, when I say that, it may not feel comfortable, but you have to get the danger down, the feeling of danger down. It has to be safe enough to start. And that's what I mean. Some people may work, for a couple sessions, not be ready, but in my experience, I believe at least a year is needed to give it a fair shot. Because part of it is learning new skills and learning to be in touch with different parts of yourself, and then the routine of it. Because I really believe, even being a psychologist and myself, I don't think therapy is for everyone. And so when you have some adequate tools and skills, and they may be tools you already have inside of you, and they were sleeping or dormant for a while, you get to create your plan and your program. So for some people who it's more helpful to continue with a psychotherapist long term, that's for them. But for some, it may be getting services for a year or maybe a couple years, and say, no, for me, my therapy is to ride the bike. My therapy is to be with my grandchildren. My therapy is to try new recipes. My therapy is to be in the community. So it's really up to the person to create the story and to finish the story. But what we really try to help with in the beginning there's some areas that feel stuck, some areas that feel disconnected, and we help the person find a way to weave that connection together.
But in some cases, do you find that people are afraid to be told that you do have a mental health problem because, they feel ashamed, they feel embarrassed, they don't know how to, how people would look at them, judge them, and stereotype them in some ways?
Yeah, absolutely. It's... I think as a society, not only in this country, around the world, that we need to do a better job to really increase awareness, because it's not okay, and I feel deep amount of sadness to think about someone feeling shame because in fact they were very brave to feel shame because you were human. It is because we are human that going through such events, be it a war or be it domestic violence in our home or community, that we're responding. Right. So I do think people like you, myself, and others who are really supporting this initiative in the community, we have to keep on talking about it as a way to really invite others to honor their experience.
To talk about it, give some kind of support or understanding.
Yes. And it's actually, often when people feel shame, there's this misunderstanding that there's something, I'm not whole, or there's something wrong with me.
I'm crazy.
Yes. But it's actually the opposite. Because you respond to something like war or separation or loss, that is because you're whole.
Right.
And I think, we know that there are so many stories that if we didn't respond, we would actually be inhuman, not human. So we really need to support each other, our brothers and sisters, our community, because it is something that we all have to do together.
So the Vietnamese patient that you've seen, well, first of all, we don't have enough psychologists, especially bilingual, especially Vietnamese, in order to help address the problem in the Vietnamese community. So how would you encourage more Vietnamese to study, to go into this field, so that we have more than one or more than, I don't know. I heard that in the entire state of Massachusetts, we have maybe a handful, three of Vietnamese psychologists. Yes. Why do you think that is? And how can we change that?
Well, I hope that anybody's watching, we can help change this. So, I know growing up in my family that, thinking about a psychologist, that's something that's very new. I'm generalizing, Vietnamese coming from Vietnam, some of the jobs that a lot of elders want the younger generation, jobs that are more familiar, that you feel like would provide you good living and stable status. It would be an engineer, a doctor, not psychologist, a physician.
Lawyers.
Yes. Yeah. And I think so, it has to be more visible, and also we have to support the worth of that. And so I am in my position at Cambridge Health Alliance, I do a lot of training. And so I'm encouraged that I am seeing a lot more therapists or training to be therapists and psychiatrists and social workers and psychologists, but it's true, it's smaller. And so we are seeing some increase, and it's just something that was not really an option, or people don't know that much about it living in Vietnam.
Or maybe the training is too hard, right? Because it's not easy to go into the field and to be able to nor would it be, I don't know, it kind of tough, and at the same time, it kind of stressful to deal with people who are in that kind of situation. So I'm not sure what the reason be. So why are there only three?
Well, I think it's, I mean, part of it, I think just exposure and, you know, being a little kid. I remember even being in school, I didn't have a psychologist come to talk about, let the boys and girls know, hey, when you grow up, do you want to be a psychologist? You would, you know, hear about the fireman, you would hear about the teacher, you hear about the astronaut, you hear, but, so we don't hear about it as much as that. Do I think it's too hard? No, I think it's challenging, but there are many jobs that are very challenging. To go to school to be a teacher, I think actually to be a real teacher day to day is much more difficult than the school.
I see.
The day-to-day work, you know, is much more difficult. So I do think with support from family and friends that that, you know, someone who is interested in the field, you know, they really should give it a shot.
Is it a well-paid?
In terms of psychologists, well, you know, I think that we're the lower, probably on the lower end of doctors, and so that's one reason. So you know, so if you think about even somebody who's going to medical school, so. You know, the heart doctor makes more than the family doctor.
That's
but
right.
the family doctor is so important.
Yes,
you know,
troubleshoot everything.
Yes, that's right.
Yes.
But that's, you know, that's. I think that's another show we can do. But
So how did you decide to become one? To go into clinical psychology?
I think, like many folks who go into mental health, it's curiosity. And we, you know, when we're learning in school, we get to learn a little bit about ourselves, and that's curious. But I also, I think that's just from my life experience and how I feel about social justice issues. One of the most rewarding things about my role is to really share with other people resources, new skills, and also even more exciting is not only to bring new skills, but a lot of times a person being a child or an adult, they have the best resources inside of them, inside of their family. And a lot of my work is helping to uncover that and stay there with them. And so that is, it's really a privilege to watch that, and you know, to watch someone grow, and there's something about a human or a flower, anything in nature, that has had challenges bloom and thrive. So in that way, it's somewhat of a selfish reason, I guess. There's something that is, I think that's very profound. No, it's the work is hard. And it can be tiring. But I just.
So is it true then? The minute you sit down with someone, whether you know the person has the mental health challenge or not, can you read the person right away?
No.
Based on the facial expression or the expression in general, how the person present him herself, can you tell right away?
I think there's some things we can learn right away, and for example, in intake, we ask a lot of questions about your history, and we just ask questions about your day to day. So these questions aren't. They're not mysterious. So just to let you know, if this was the first time you're coming in, I may ask about your sleep. And I might ask about your eating.
I see.
Right? And that's something the Vietnamese family, we ask about, right? They're not uncommon questions, but there may be some questions that I focus a little bit more on to understand. I may ask about, how do you spend your weekend? I may ask about your energy level. Your memory and those types of things. And that gives us information. I may ask about your wishes and your fears. Those are some questions. And yes, verbal, nonverbal, I should say, it gives us some clues. But that's really just a start. And I've worked with some people for many years until they've told me something that's really important. And that was not told to me before. Although we did a lot of work and we did a lot of important work, people are very unique and they have rich histories. And you know what? They really don't have to tell their doctor everything. And so now I don't know, but I asked them, what I can support you with is only what you share with me. So that's as far as we can go, and I do the best I can with what they're willing to share with me.
I see. So do you feel involved afterward, like say, after hearing so many problems the patient have, and then you feel exhausted from it, or you feel concerned, or you have some kind of a, I don't know, stress level where it's affecting you as well? I mean, because I've had some friends who are clinical psychologists, and they basically, for some reason, affected by listening and dealing with just one after another people with mental health problems. So it's gonna so it affects you in some way. So, for example, this is just my very small, limited sample here to say. So I don't want to generalize. I make the general assumption, but at least I have two friends where they're Vietnamese psychologists, and so they respond to things very slow because maybe they try to be careful in how they assess the situation. Say when you ask the person something, and that the person would have a long thought processes, a long pause to answer your question. So is it because it's affecting you in some way? You have to be very careful in how you convey your message or something?
I'm not quite sure. I mean, I'm trying to think about long pauses. I think for one thing in our training, one thing is encouraged, certainly, that we're not impulsive. So I'm not quite sure if I have long pauses with patients I work with. I mean, how it affects me is, I think, how it affects many people who are in the helping profession. And one thing to think about is, as the people I'm working with, I'm also a human, and so it's important for therapists and people in the helping profession, including teachers and first responders, that we also have our own support. So I have a group that I meet with every month, and we support each other and talk about cases, and we're able to help each other and remind each other if maybe you're taking this a little bit too personal, or maybe you can lighten up your schedule.
I see. So we only have a few minutes left. So if you can give an overview of, say, if I were a patient, I come to you, what do I have to do?
Okay. So if you were a patient and just interested in wanting to try to see what therapy would be like, the first time you would come to see me, I would ask you some questions about why now, and you could say, oh, I just heard something on VATV, so I thought, maybe it'd be helpful. Some people say, my wife told me to come, or it could be anything.
Okay.
And so, the first time we would talk a little bit about your history, and what you are currently experiencing, and I go back to some of the questions we mentioned earlier. It's nothing, no smoke and mirrors. It's actually very direct about your day-to-day functioning, and what would you like to see change?
I see. So how do people contact you?
To contact me,
Yes.
I'm at the Cambridge Health Alliance. I can be reached at 617-591-6420, and that's my direct number. So if someone was interested just to ask questions, even if they weren't interested in coming in, that's fine as well.
Yes.
And just to be clear, at the Cambridge Health Alliance at this time, that we are able to see folks who have a primary care with us.
I see.
And who live in our catchment area.
Okay.
Which includes Cambridge, Somerville, Malden, Chelsea, Revere, Everett, and Winthrop. And I also want to bring attention to some really great services and clinics we have, both Dorchester House in Dorchester, Neponset Health Center, and also South Cove. They have services both in Chinatown and in Quincy. And those are just a few that are close by, but there are more. And I'm happy to help anyone with questions and help anyone connect with a provider.
But I hope that you do come and work at the Dorchester House because, we only have Dr. Nguyen, but he works only once a month, so it's very limited. We have had problem recruiting.
Yes. And well, we've been, as I said, I'm very, very happy to help collaborate and work with you or Dorchester House. And that's how we do. We have to do it together. There's not enough.
Okay. All right. Great. Thank you so much. We truly appreciate your time. I know how busy you are.
Yeah,
so
thank you.
Once again, we hope that you enjoyed the show tonight. And for any question or comments that you have, please contact VATV at VATV.org. Email is VATV@VATV.org, or you can call at 617-822-3717. Have a great evening, and we look forward to having you back on next week's Wednesday. Thank you, and have a good evening. Thank you again.
Thank you
for coming.